Alright, so what we want to talk about is a frequently asked question in our office. We do upper cervical chiropractic work in Los Angeles. Basically what that means is we are experts and specialize in correcting the top two vertebrae in the neck and their relationship to your spinal cord. So probably top three, number three on the list, most common thing we see in our office is low back pain, sciatica, and low back disc problems. And so when someone comes into our office and they've been referred in and they find out that we only adjust the neck, sometimes they have problems understanding, well, how in the heck, why does this guy keep talking about my neck when I have low back problems? So let's just go through a couple really quick things to help you understand how the upper neck influences not just the neck but the whole spine. So the head weighs 10 to 13 pounds. It sits on a 2-ounce bone, the atlas. And when you have a neck injury in the vertebra, the atlas displaces and locks out of position. The first thing that happens is there's an interference to the brainstem area, and the brainstem area is what controls and modulates muscle tone on both sides of the spine. So when the atlas misaligns and locks, the muscles through the spine become asymmetric in their tone, not just in the neck, but actually through the whole spine. Low back muscle tone is controlled in the upper neck. And so if you have a neck injury, there's an adaptation through the whole spine. All of a sudden one hip becomes higher than the other, or the head's off center, or one shoulder is higher than the other. And initially most people may not have back pain, but if it stays there long enough, a very high percentage of people from being structurally out of a balance will start to have low back problems, and in a smaller percentage of cases they'll develop a disc injury. So what I want you to imagine is the atlas is out of position, the head gets off center, one shoulder higher than the other, the opposite pelvis gets high, and so you're walking around with one leg longer than the other, and you do that long enough, the L5, S1, and L4, 5, which is in the low back, there's a disc that sits between the vertebra, right? And so when you have asymmetry in the structure of the body, all of a sudden there's more weight on one side of the disc than the other. And so as time goes on, 10 years, 20 years of you being active, bending over, yard work, whatever, sitting in a car, there's more stress happening to one side of the disc than the other. And the most common thing we hear in our office is, oh, my husband, he was in the garage and he was just turned slightly to one side. He wasn't even picking up something heavy, and bam, he got back pain. It went down through the leg and he was on the ground, and we had to wait an hour before we could even get him off the ground. Now the patient thinks that that pain started when he did whatever he did in the garage, when in fact what started that in process happened 15, 20 years ago. So in our office, and most upper cervical offices across the country, we see 10 to 20 surgical low back cases a year, and not all of them, but a very high percentage of them we're able to fix, or we're able to allow the body to fix the low back issue so they don't need surgery. So reverse what I just told you. Person comes in, they got a 5mm disc in their low back, they have sciatica down the leg, we run some tests, we find C1 is locked out of position under the skull, we take very precise x-rays that look at the joints that tell us how the vertebra's off, and then once we have that information, we make a very precise correction to put the vertebra back under the body's control, which clears out the spinal cord of the irritation. And so now the body starts to restore normal muscle tone, right? The posture starts to straighten out, the pelvis that was unleveled starts to straighten out, the muscles that were in spasm at that disc level start to relax. And in many of these cases, that disc that was on the cord, as the muscles start to balance out and become more supple, is able to suck back in, and you don't have the pressure on the cord anymore, and lo and behold, they don't need surgery. So upper cervical care, of course, is not a cure-all for everything, but it has been very, very successful in helping people with disc issues. So if you have a disc issue, do yourself a favor and go into an upper cervical chiropractic office and see if it can help you.